one good way of learning ethics, morality, and law and their interrelationships would be to consider cases and to look at things from different perspectives and to choose a couple of concepts from morality, law, and ethics, and then try to see how they play in particular situations. And that's what we'll be doing to supplement the actual lecture on ethics and law. And to give you additional ideas, which one session or 1 to 2 session ethics and law lecture does not cover, but which you really, really need to know about before you start doing stuff and practicing when you're residents or fellows, or especially if you're consultants and you're completely responsible for your actions without any teachers, mentors, or supervisors behind you, right? So responsibility increases and increases, and of course the liability increases as you get there. So today we'll be talking about the idea of false imprisonment and the way I'll do things. Of course, this is not, a session for lawyers. I mean, I would guess if a senior law student or even a first-year law student, if they listen to this session, they'll scratch their head and wonder why something so basic is being given to senior medical students. And the simple answer is medical school, as we do things right now, doesn't contain a lot of law or even ethics and morality. But medical practice, when we graduate, this problem can be so glaring when you start taking on more and more responsibilities, and the patients you're taking care of present with more and more complicated disease processes, especially those with life-threatening or terminal illnesses or diseases. Then you realize that law, ethics, and morality are very important. But then, of course, you already graduated. You have to start somewhere, and you have to start with the basics. Unfortunately, there's not a lot of basics that went into your early years of medical school. There's not a lot that we can remember because we are constantly bombarded with the other stuff, right? And of course, I'm not a lawyer, so the idea is not to make you know the details about the legal part, but just to help you understand some of the really basic ethical, moral, and legal concepts or considerations, ethical, legal, and moral considerations when you look at particular situations and cases. So, false imprisonment, okay, and home against medical advice. Of course, those two, at first glance, don't look like they're related. False imprisonment, you imprison someone against their will. That's false imprisonment. Now, if we add a little bit of detail into it, so what does imprisonment mean? Well, you put him inside the place. They can move about, but they cannot go beyond the boundaries of that place. You restrict their movement, and somehow that action of restricting them brings them some form of harm. The most obvious would be physical harm, and then you can also consider emotional harm. So that would be false imprisonment, right? So now you can restrict their movement to all sorts of means. The most obvious one would be physical restraint. That would be what you see in prisons. Right now, everyone considers not just physical restraints, but emotional restraints or chemical restraints, which would be common in medical settings. Physical restraints would be you tied the patient down or somebody down against their will. Chemical restraint would be you may or may not have tied them down, but you drug them up so that they're very weak and they're so groggy that they can't get up or get anywhere using sedatives or whatnot. And emotional restraint. You use fear or threat to prevent them from going out. I mean, the most obvious non-medical example of emotional restraint would be a spouse who's being battered and abused, and they cannot get out of the house because they're being threatened emotionally by the abusing spouse. One very good example of emotional restraint would be intimidation. If you do this, this will happen to you. It's fear. If you do this, this will happen to you. So that would be an emotional restraint. Obviously, the person you're talking to would be anxious, fearful, and wouldn't want to go out of the boundaries of that confined space, right? So now what's home against medical advice? Well, home against medical advice is someone in the hospital who doesn't want to be in the hospital. Actually, there's a place they want to go to, so they want to get out of the hospital and go back to their house. Let's go home against medical advice. And then the advice of the doctor would be, don't do that, because it will get you in trouble as far as your diseased state or state of illness is concerned. So we cannot, if you ask us, or we cannot take care of you, or we cannot guarantee your safety, and it wouldn't be good for you if you go home. Okay, but the patient and or the family, if the patient is already incompetent or cannot decide for themselves, right? The patient is stuporous or comatose or whatnot. Of course, that's not the topic today. The family still wants to take the patient home. Of course, the situation becomes more complicated because you have the family deciding for the patient. Of course, legally they have the right to do so because the patient is already incompetent. The argument of the family is we're deciding based on how well we know the patient and what we think is good for the patient. Now, if you're caught in that situation, you have to ask the family and figure out why they want to take the patient home, because it has to be either we know the patient and this is what he wants us to do, or this is what he would want, or we think it's beneficial for the patient or for some reason, and then they have to tell you why. Now, if they cannot express that, then you can question their decision. And if you really want to protect the patient, if you sense that there's something wrong with the decision, it's either being done in a malicious manner or the basis of the decision has nothing to do with the patient. Legal ways to prevent it from being followed protect the patient. Of course, that's a hard thing to do. And, normally hospitals and doctors don't really want to go there. And I would guess a lot of patients get in trouble, especially if you're dealing with a decision maker who doesn't really have the patient's best interest in mind, or who doesn't really want to uphold what the patient wants. So anyway, so that's home against medical advice. But we'll keep it simple. Let's assume that the patient is competent, right? So he can decide for himself. Okay, so what's the connection between the two? Well, if the patient wants to go home and you say, no, you cannot go home, and tie the patient down or drug the patient out, because, obviously he cannot go home, so let's drug him out, or tell them that the security guard will block them, then it looks like, as far as, our non-legal minds are concerned, it looks like false imprisonment. We're restraining someone from going where he wants to go, right? So now, would it be acceptable as far as the society's sense of morality is concerned? Well, it depends on the society, but overall, at first glance, it wouldn't be acceptable for most people unless this person's decision will harm himself or harm others. You're restricting the patient because if he does what he wants to do, he'll be harming himself or he'll be harming others. Obviously, as far as the home against medical advice is concerned, the most obvious harm is the patient will harm himself because the doctors themselves are saying, no, you cannot go home. Because from our medical standpoint, it will almost definitely get you in trouble and harm you. And that was the case like several decades ago. It's not the case right now. Why? I would guess because the way people look at the doctor's decision making, they don't think it's the final basis for actions. Right now, if you look at law and ethics, autonomy and freedom to choose and self-determination is supreme. So meaning we try our best to follow what the patient wants or to give the patient what the patient wants. That's the reason why we have home against medical advice. We're following the patient, but we want to make sure everybody knows what happened. And this is what happened. We sat down, we told the patient the risks involved, specifically this, and this. And then my advice again is for situations which can be very complicated ethically or legally or can be questioned later on, make sure you write everything down clearly. Don't just rely on a form that says, we told the patient about the risks and he understands and then that's the end of the story. That's like typewritten or photocopied forms. That's not going to help you much because the question is, what are those things that you told the patient? The patient and family can always say, well, he might have said that, but we didn't understand it. Or he didn't say that. He just said this, this, and this. Those are the only risks discussed, and there's no documentation to prove that you actually did. Okay, so for these kinds of situations, don't just rely on those really short forms, which only says we told them about the risks. It doesn't say what risks, and they understood. It doesn't say what they understood. That's not really going to protect you if it becomes an actual case in court. Okay, so now if you have that kind of form, fill up the form and write every other detail which you think is important or which you think you might need later on. Okay? That's the home against medical advice form or document. Okay? So meaning, as far as the patient is concerned, well, the doctor sat down and, I'm signing this because it actually happened, and this is what he told me. All these things, then the doctor or the patient can write down the details. Usually it's the doctor and the patient reads it, and the doctor tells the patient what's written down. And so he told me this, and I know exactly what going home means, but I still want to go home. And this shows that it was my decision, and I understood fully what might happen to me, especially the harm that might happen to me. Okay? And then you sign the form. Actually, when you say harm, it's not just the patient. The action might actually cause harm to the patient and the family. For example, the patient signs home against medical advice, but nobody told them that this is going to happen. Meaning, he goes home, he rides the car, and the doctors actually know that there's no way he can reach home. Something happens along the way, and the patient experiences a lot of suffering, physically especially, like physical symptoms like really short of breath, having a lot of extreme chest pain or whatnot, or having seizures, or delirium, and something that causes a lot of harm to the patient or a lot of suffering, physical and emotional, and the family members with the patient in the car as they attempt to go home against medical advice witnesses the entire thing. So that's the family's traumatized. That's emotional harm on top of everything else, right? That's a valid harm as far as the law is concerned. So where's the problem with that? Well, the problem with that is the doctors didn't tell the patient and the family that this will happen, and it caused harm. So limited information given. Now remember, home against medical advice is a decision, but it has to be a well-informed decision, well-informed decision making. For it to be valid, they don't need to know all the details about the disease or the pathophysiology of the disease. All they need to know is, but they need to know the important information that any rational person would need for them to decide well on that particular matter. Obviously, the possibility of this happening inside the car, well, that's an obvious information, especially if the doctor knows that it can actually happen. Now, the doctors cannot say, well, they didn't ask us. Well, they're not doctors, and they're confused and they're emotionally distraught. Not distraught enough to make them incompetent, but, they're very emotional. They didn't ask me is not an excuse. Usually it's up to the doctors to tell them what the harms are, even if they don't ask, right? For that home against medical advice to be valid and decently protective as far as the doctors and or the hospital is concerned, right? Now, there's another thing I have to warn you about. If you're in a place that's, and I'm not going to mention what place or what institution or institutions, or what country, could be any place, but if the place is sufficiently morally corrupted, okay, then the idea might be, you just have to get them to sign the paper by whatever means. By whatever means, especially if the patient can easily be made or forced to sign the paper. So, for example, there's a discrepancy in educational background. There's a discrepancy in socioeconomic status. Doctors and the patient is a charitable case. Very disempowered populations, very vulnerable populations, and you can easily force them to sign any paper. All you need to do is just give them either false information, withhold information that would make them not sign the paper, or employ some form of emotional force, like intimidation, to make them agree, to make them want to leave or agree to leave the hospital. Okay, so there are several problems related to that. The first problem is, you don't make them want to leave the hospital. They initiate the idea, or they tell you that they want to leave the hospital. You don't force them to leave the hospital. They would tell you that they want to leave the hospital, and you're supposed to tell them, based on your medical judgment, it might not be a good idea. That's pretty much how it should go, right? So sometimes, some places we go for the counseling tactic. So, meaning the counseling session. Like the patient that really doesn't want to go home, and everyone in the hospital wants them to go home for some reason. Okay? And usually it has nothing to do with the patient or the family. But they can't manage to convince them. So they get someone who is good in counseling. And this person sits down, employs all the possible counseling techniques to make the patient agree or want to go home. And if you look at all the possible counseling techniques used all throughout the ages, it also involves withholding information, exaggerating certain pieces of information, pushing them so that they become sufficiently emotional, or changing their narrative or perspective such that they would want to go home. And that also could be another form of psychological or emotional coercion. Informed decisions, the requirement or the legal requirement is it must not be coerced. So doing that kind of counseling is, that's easily psychological coercion. The reason why that's not right is because, one, the idea behind informed decision making, like you're deciding if you want to go home or not. This also applies to like decisions for not wanting CPR, is so that you can fulfill the requirements of the law, fulfill the legal requirements. So again, the legal requirements would be sufficiently informed. They have all the information that they need so that they can decide for themselves, what they want, not coerced. The person helping them, allegedly, or the person trying to get their decision, is not coercing them in any form or in any way, including psychological coercion, which might not be blunt, but it's masquerading as a counseling approach. And they have the capacity, the person making the decision has the capacity to decide. So, meaning there's the information, there's his life values, and then he can think about it. So his rational capacity, or his capacity to think about it, is there. And then he can tell everyone what he wants. So that's pretty much what the requirement is. So the entire process aims to make sure that it's a valid decision. Now, counseling might come in, not in the sense that, you're trying to counsel the patient so they'll decide this way. So that's not where counseling comes in. Counseling comes in to emotionally support them and guide them. Meaning, if you're trying to think about it and they're fighting among themselves, then maybe it's the job of the counselor to try to decrease the emotional tension so that they can talk better and so that they can decide better. Or if the patient's very distraught and emotional, maybe the job of counseling would be to help the patient calm down so that she can sufficiently think about her values, the patient's values, what the patient would have wanted, if it was the next of kin, what the patient would have wanted, and decide well. Right? And the person doing that, the counselor doing that, must not be employing those techniques to make the patient agree to going home. Those are two different things. Of course, you can reason it out that you're actually aiming for enlightenment or insight, but then the proof would be how the patient and the family reacts afterwards. Because if the decision really causes harm, and some of them will realize, they probably made the wrong decision, and how come they didn't tell us about this? And they go home thinking that it's really how it is, and then somebody tells them later on that they had a choice, and people can actually decide to stay and not go home. Then the doctors can be liable, or the one who got the consent or made them sign the consent, home against medical advice form, can be liable. Now, how bad is the liability? Well, it depends on how much harm you caused, right? And it depends on whether you actually informed them about that harm. It could be physical. Dying would be one. Injury would be another. And you don't need to die. You just need to experience some physical harm, emotional harm. It's pretty obvious. So those are the things that would make your case worse as far as you're concerned. And obviously, the very sick, the very weak, the distraught, very emotionally affected family, in the eyes of many, are very vulnerable individuals, especially the patient who's very weak lying on the bed. Now, inflicting harm to those individuals increases the severity of the wrongdoing, makes the wrongdoing more severe, right? You are responsible for harm happening to vulnerable people. The bottom line is not to muck around with the idea of informed decision making, not to play around with the basic good intentions of what home against medical device is supposed to do. It's not a way for doctors and hospitals to legally sort of send people home against their will. It has to be a well-informed, uncoerced decision. Now, false imprisonment can also be applied to another situation. This is not a terminal case, or it can be, but a more stable kind of terminal case. We'll keep it simple. This is like someone who can live for at least for a few months, or is not terminal, but they cannot go home because they're not paying their bills. While they stay in the hospital, the bills that they cannot pay keeps on piling up. That's false imprisonment. That's the most obvious false imprisonment, and most of you know that. And in a lot of countries would have laws against that. The question is, how come it's still being done? Well, the answer is that's really the question, right? So I guess it can only happen in a place where there's a certain state of lawlessness, and the medical care community, including some of the doctors. Well, it cannot happen if it's just a minority of the community, or at least the entire community, or most of the communities involved. Like, you either know about it, but it doesn't affect you, so you don't say much about it, or you know about it and you know it's bad, but still keep on doing it because it works in your favor, right? For some reason, making the patient stay works in your favor. Now, obviously, for a medical institution that's not being paid, that the interest is pretty clear. Now, as far as the doctors are concerned, well, I guess it would make sense if their interest is congruent with the interest of the hospital, or similar to, or rides with the interest of the hospital, and you're more concerned about their interest than the interest of the patient who's stuck in the room, falsely imprisoned. Of course, the laws are different depending on what country you're in, but that's the general idea of false imprisonment as applied to someone who cannot pay their bills and is not allowed to get out of the hospital because of that. And again, in countries with which the law is not completely respected, you can hear people give all sorts of reasons why they're doing it, and that's supposed to make things right. Well, if it's the law, then it's the law, no matter what reason you give, right? Anyway, we're getting off topic, so we'll probably end there.